My name is Shawn Feinstein. I'm one of the sports medicine physicians. I work primarily out of our Hanover or Mechanicsville office. Sports medicine in general specialize in surgeries centered around the shoulder and knee primarily, but we do some surgeries all throughout the body. But sports medicine in general does treat injuries all over the body as well as patients of all ages. When I was deciding a good topic to talk about today, I thought about meniscus tears as a topic that can affect people at all ages. And even though it affects, there might be a similar type of injury, what we do about it is vastly different based on a number of factors, which I'll talk about today. I do think it is important that after hearing this and taking some of this information in, that you understand that each patient is different and each treatment plan will be individualized for you specifically. So if we can get the slides up. So the title of my talk today is I tore my meniscus, now what? Okay. So to start, what even is a meniscus? Well, the meniscus is a C-shaped piece of cartilage that sits between the femur or the thigh bone and the tibia or the shin bone at the knee joint. It functions primarily as a shock absorber, helping to protect the cartilage of the knee by dissipating the force that happens every time you take a step. It also functions secondarily to stabilize the knee. Each knee has two menisci, one on the medial or inner side of the knee and one on the lateral or outer side of the knee. So how do you know if you tore your meniscus? Well, the most common symptom of a meniscus tear is pain. Pain is typically worse with the knee in a bent position, for example, during squatting. And some people also experience swelling, stiffness, which could manifest as difficulty bending or straightening the knee. Other people also experience a sense of catching or locking within the knee, as well as the knee giving out or giving way. When I see a patient in clinic with these symptoms, there are certain maneuvers that I can do as part of my physical exam, which can suggest a meniscus tear. While we always get x-rays as part of the initial evaluation, it is important to understand that we cannot see the meniscus on x-ray. That requires an MRI. However, an x-ray gives us a lot of other information about other potential causes for knee pain and swelling. In deciding on the most appropriate treatment option, it's vital to consider how the meniscus is torn. There are many different types of tear, and some render the meniscus still functional, while others render the meniscus non-functional, such as a radial or vertical or longitudinal tear. As we advance to the next slide, you can see that the meniscus, this is a picture from surgery showing the position of the meniscus root. This is that same meniscus root completely torn off the bone. And this is one of the tear types that often requires a surgery in order to restore the function of the meniscus, as this type of tear renders it completely non-functional. Also, there are certain types of tear that will limit range of motion, such as the surgical picture shown here, which is called a bucket handle tear, where part of the meniscus tears and flips into the front of the knee. This will very commonly cause significant limitations in range of motion or even a locked knee. So aside from the type of tear, we also consider a number of other factors when deciding what to do about it. As much as we would like to ignore it, age is a real consideration when discussing treatment options. We also take into account whether this happened as a result of an acute injury or whether it happens from degenerative changes such as arthritis. One of the most important aspects to understand about the meniscus is its limited blood supply. As seen in the picture on the right of the screen, the blood vessels only travel so far into the meniscus from the outer edge. Blood supply is required for a meniscus to heal, so tears of the inner edge of the meniscus are often not repairable because they just don't have the blood supply that's necessary to heal. This is an MRI image showing a normal meniscus, only to show how only the outer or peripheral portion has the capacity to heal, and any tears of the inner portion are very unlikely to heal, even if stitched together or repaired. It's also important to consider what else is going on in the knee at the same time. Injuries that cause ligament tears, such as a tear of the ACL, often have meniscus tears at the same time, and those are often tears that we are trying to repair. Probably the most common coexisting problem with the meniscus tear is arthritis, as shown in the far right picture. And that is where the cartilage on the ends of the bones is degenerated. And it's very likely that in this case, the cartilage is causing more problems than the meniscus tear. When we talk about treatment options, the first line for most meniscus tears is non-surgical. Just as with any other injury, rest, ice, compression, and elevation work to decrease swelling and inflammation, thereby decreasing pain. Anti-inflammatory medications, both non-steroidal and steroids, can be very effective in decreasing inflammation as well as pain as well. And other pain relievers can be effective, such as Tylenol or topical treatments like lidocaine patches or capsaicin cream. Rehabilitation exercises to strengthen the muscles around the joint can be very helpful, and working with a physical therapist can incorporate not only a specifically designed rehab program, but also other modalities and techniques which may be helpful. There are multiple injections, the most common of which is a corticosteroid, or also known as steroid or cortisone injections. Those, again, decrease inflammation and can be very helpful in controlling pain. There are other injections that are used less frequently, but can also be effective, such as what we call viscosupplementation or PRP or platelet-rich plasma injection. When it comes time to talk about surgery, meniscus surgery often falls into two categories: repair or removal, or cleanup surgery. All of the meniscus surgery that I perform is done arthroscopically, which is a minimally invasive technique using a camera and specialized tools to work within the joint through small incisions. So the answer to the question, what to do about a meniscus tear, is that it depends. Each patient's treatment plan is individualized based on many factors, some of which I've tried to highlight on this talk today. I do want to acknowledge the website OrthoInfo, which is a good resource, which is developed and reviewed by members of our professional organization, the American Academy of Orthopedic Surgeons. It is a reliable place to look for information if you're going to be doing some research on your own online.
Thank you so much. We do have a lot of questions. So, how do you know when you are good to start working out again after a meniscus tear?
It depends on how the meniscus is torn. If it's the type of tear that I would recommend just going in and cleaning up, the answer is whenever your pain allows you to get back to doing things. In cases where I think a meniscus repair is more appropriate, then after we do that surgery, we decide when the most appropriate time to get back to activities, and that will depend on how it's torn and what kind of repair you have.
What are the activities you should not do when you have a meniscus tear, including any sitting or standing or laying down positions?
Again, most of the activities that you should avoid will cause pain. So you use your pain as a guide to tell you what you can and can't do. That tends to be deep bending or squatting position, especially with loading. So if you just bend your knee when you're not standing on it, it might be okay. But if you go down into a squatting position, especially a low squat, that's going to be a little bit more irritating. In general, lower impact activities tend to be less irritating than higher impact activities like running or jumping. But in general, the activities that don't cause pain are probably safe to continue.
How long is recovery after a meniscus tear?
Now that's a good question, and something everybody wants to know when we talk about surgery. Again, the answer is it varies. It can be for meniscus cleanup surgeries, you're in and out the same day. You can start putting weight on your leg as soon as you're comfortable doing so. So there's really not much downtime for those type of procedures. When we talk about doing a meniscus repair, it's generally anywhere from 2 to 4 weeks of not putting any weight on your leg, and then another couple weeks still on crutches, starting to put some weight on your leg. So it can be wide variation depending on the procedure, anywhere from starting to walk the day after to being on crutches for about 6 weeks after surgery, allowing the meniscus to heal.
Does insurance usually cover meniscus repair?
Just about all insurance companies will cover the cost of a meniscus repair if indicated.
We have several questions about arthritis and age and meniscus tears. Can you go into a little more detail about that?
And I think that's the most common situation where I see meniscus tears is people who have some arthritis as well. The question and something that may be more of an art than a science is, which patients who have a meniscus tear and arthritis are going to get better from just cleaning up the meniscus, because the arthroscopic surgeries that I do can't really address arthritis. They can't put back cartilage where it's worn away. So the question is, how much pain is coming from the arthritis? How much pain is coming from the meniscus tear? Well, there are certain degrees. If you have severe arthritis, cleaning up the meniscus probably won't help you. If you have just mild arthritis, cleaning up the meniscus could be very helpful. So, the question is, we take into account what the x-rays look like, what the MRI looks like, to get a sense of how much of the pain is coming from arthritis, how much of the pain is coming from a meniscus tear, and that helps to decide how much improvement you might see after a meniscus surgery.
Do you have tips on keeping a knee healthy after a meniscus repair?
So the first tip is to always follow restrictions and work with a physical therapist after any surgery to make sure that you're following the right kind of schedule and doing the right kind of exercises within that timeline. Once a meniscus tear heals, the best thing that you can do is keep the muscles around the knee strong, and that helps to stabilize the joint. And then maintaining a healthy lifestyle with moderate, vigorous activity several times per week, and maintaining a healthy weight. That's how you keep the knee healthy.
We have a couple of questions about people who have had meniscus tears and then who have sort of a popping sensation in their knee, and it kind of pops in and out. Can you describe what's going on? Do they need to seek care for that?
Very often that the meniscus tear will create a little flap of tissue where that tear is, and depending on the position of the knee, that little flap of tissue can move around. That generally is not anything dangerous in that you have to get that taken care of, but it can be pretty symptomatic, and people can really feel, it can feel very uncomfortable. I think those are the patients that tend to improve the most after surgery, the people who have what we consider mechanical symptoms, or the catching or locking in the knee. They tend to find the greatest improvement after this type of surgery. While it's nothing dangerous, it can continue to be symptomatic, and that is something that the arthroscopic surgery typically helps.
Do you recommend cold or heat to reduce pain?
In general, especially after an injury, cold is probably going to feel a little bit better. When you have a meniscus tear, when you have arthritis, it tends to cause swelling. That swelling is from inflammation, and the swelling and the inflammation cause pain. So if you can decrease swelling and decrease inflammation, that's typically done with icing or cold. That can be very helpful. Occasionally people will tell me that heat feels a little bit better on their knee. That's usually not right after an injury or right after a flare. But if that's the case, there's no downside to using heat if you feel that works better.
We have a few questions from people wondering if they have a small meniscus tear, if they need to get it repaired right away, how long should they wait, will it get worse? Are there things that they should be on the lookout for in that situation?
I think that's a good question, and everybody's a little different. In general, if you have an injury and you think you may have a meniscus tear, the best thing to do is to seek treatment, identify and characterize the tear, because, as I've shown, there are some tears that essentially render the meniscus useless or non-functional. If the meniscus is torn in one of those ways, going in and repairing it or fixing it early will help to preserve the function of the knee long term, because we're giving back that shock absorber and that stability to the knee. In a lot of cases, when the meniscus is torn in a way where it does not need to be repaired or cannot be repaired, well, in those cases, it's really not hurting just to try to manage it non-operatively until you just can't any longer. It just depends. And the only solution is to go in and clean it up. No, there's no rush to go in and do that. You can manage as long as you'd like without that. But there are certain type of tears where if we can get to it and fix it sooner, it has a little better healing potential than if we wait several months or years.
Can you go into a little bit more information? Can PRP regrow the meniscus, or how does it help there?
So in general, PRP is used for its anti-inflammatory effects. So it really doesn't help regrow the meniscus. There's nothing that exists right now that can help regrow the meniscus. And, as I talked about with the blood flow issue, many times meniscus tears don't heal. So I see a lot of people who have a lot of pain from a small meniscus tear, and we do an injection or we do some medication or some physical therapy, then their pain goes away. That doesn't mean that the meniscus has healed. The meniscus is very likely still torn, but if it's not causing pain or any dysfunction, then a meniscus tear is not something that we have to worry about in general. So PRP is more anti-inflammatory than anything else, but it is a bit of a more natural substance, since it is spun down from the patient's own blood rather than a medication such as steroid or some of the viscosupplementation.
Can you give a little bit more information about who is likely to have a meniscus tear?
The reality is that anybody can get a meniscus tear, and it can happen, at almost any time. For a young person, it's very likely to be associated with a specific injury. So, injury related to sport, something like that is typically when we see a meniscus tear in a young person. As we get older into our 40s, 50s, 60s, meniscus tears can happen without any kind of injury. Those are what we call the more degenerative tears, but anybody can really get this, a meniscus tear. When we talk about people who have arthritis, you are at higher risk of having a meniscus tear as well. But again, if the arthritis is severe enough, then the meniscus tear probably isn't even the issue.
Are there exercises you could recommend that someone could do at home for this?
Yeah, so there are a ton of exercises, that are exercise programs. In general, anything that strengthens the muscles around the knee and works on preserving knee range of motion is going to be very helpful. The organization that I talked about, the American Academy of Orthopedic Surgeons, or AAOS, has a good at-home program that they have listed online. You can also work with a physical therapist who can design a program specifically for you. There may be exercises that hurt you every time, and a physical therapist is going to be really good about, designing the program and customizing it for things that each person is able to do based on maybe the resources they have at home or, what irritates their knee.
You mentioned that the meniscus doesn't have a blood supply everywhere in it. So knowing that blood is necessary for healing, how does a repair by a surgeon allow it to heal if there's still not a blood supply?
There is a blood supply in part of it. And so really when I'm talking to people about meniscus repairs, it's going to be the type of tears that do have a blood supply and allow it to heal. The meniscus tears along the inner edge do not heal, and those are not the types that I would repair. The things like a meniscus root tear, well, that's the entire meniscus that has torn off the bone, and that has a fairly good chance of healing because the blood supply to the entire meniscus is still pretty good. So in general, there is some healing capacity. It's just not as good as we would like, and we definitely take that into account when we're recommending a specific treatment.
Thank you so much. Is there anything you would like to add before we close?
I just want to thank everybody for joining us today. And, there's not one size fits all answer for this type of issue. So if you're having any issues like that sound like this, or you've had discussions like this in the past and want to have the discussion again, please just call our office, set up some time to talk with us, and we'll make a plan that's specific for you.